And we turn to health now, where the University College Hospital, UCH, in Ibadan, Oyo State, is facing a power crisis as it owes the Ibadan Electricity Distribution Company up to 495 million naira. Despite initial denials, UCH Public Relations Officer Mrs. Funmilayo Adetuyibi confirmed the debt and appealed for help to settle it. Now, doctors, nurses, and staff have limited their working hours until power is restored, with a threat of a 7-day strike if the issue persists. Now, patients on admission are at risk as services are scaled back due to the power outage. UCH seeks assistance to offset the debt and ensure uninterrupted healthcare services. And now to discuss this, we're joined by Dr. Laz Ude Eze. He's the founder, Make Our Hospital Work campaign, and he joins me live. A very good afternoon to you, sir. Let's get started very quickly. As a global health advocate and founder of the Make Our Hospitals Work campaign, what are your thoughts on the situation at the University College Hospital regarding its power crisis? And just to add more to that question, how do you think it's going to impact, patient care and overall healthcare delivery and quality?
Thank you very much for having me. I think it's quite disheartening that this is happening at the University College Hospital, Ibadan, the foremost federal teaching hospital in the country, with about 1,000 bed capacity, and of course, arguably the best or one of the best teaching hospitals in the country. Ibadan is where I trained. UCH Ibadan is where I trained, so I have emotional attachment to what is happening. It shouldn't have gotten to this stage. I've read the news. I've also watched certain interviews where the chief medical director, Professor Tebayo, was making public appeal. And there are certain questions we must ask, because this is an accountability issue. How did we get to this stage? How did it get to the point where the hospital is, as reported, owing more than about 400 million naira, to the extent that the electricity supply or power supply is cut off completely? Can we imagine the extent, the intensive care unit implications, like you asked, on the patient is enormous. Like I said, there are about 1,000 beds at UCH, and most times it's usually fully occupied. And of these, there are people in under intensive care, both adults and children intensive care units. There are people who may have been scheduled for different procedures, surgeries, diagnostic interventions over a period of time. So the implication is those who are under life support or intensive care, that care is going to be interrupted. Some of them might not make it alive, very unfortunate. Some may have, those who have money may want to transfer theirs to other hospitals. Those who don't have money will resort to prayers or self-help. It's also kind of very frustrating for the health workers themselves, who may have treated patients from the point of entry. And with these early incidents, we have to watch those patients deteriorate. Patients that are getting better will now get worse. It's frustrating for relatives of patients who have been caring for their loved ones, who have spent some reasonable amounts of money, and this has reduced the progress that is being made, and they will have to go elsewhere to begin to seek help. So the damage is unquantifiable, and we should never have gotten to this stage in the first place. I think it's a failure of leadership and management, at that level. All those who are involved, beyond arresting the situation in place at the moment, should also have certain steps taken to ensure that this never happens again at UCH, and indeed any hospital in this country.
Right, Doctor. Yeah. I mean, you just said that the damages and what is happening, it's just inconceivable, right? Let's talk about measures, right, in terms of solutions and just addressing what exactly the root cause of this is. There's financial struggles with this hospital, and I mean, this is just one, and I'm sure out of hundreds that we when it comes to our healthcare sector. How then can we not only just address the root cause, but also ensure the sustainability of healthcare services in the long term?
Yes, thank you. In the case of UCH particularly, the root cause analysis has to be done. How did it get here? And those root causes should be addressed. But on the immediate, well, I don't know how successful it's going to be. The public appeal has been made for people to make donations, and I encourage Nigerians to respond to that public appeal. And of course, as alumni members, we should also take part of it to make that appeal, but beyond that, the government of Nigeria, the Federal Ministry of Health, the Minister of Health should please intervene, let this be resolved as quickly as possible. UCH is very significant in this country, as a health institution, not just for patient care, but for training of doctors and medical students, and also for research, So this should not last additional 24 hours. It should be treated as a national emergency. This also speaks to health financing model that we have. Now the electricity tariff has been increased for places that have up to 20 hours power supply, which I assume many of our health institutions will fall within this range. So this also means that the electricity bills will even further increase, not only for UCH, but also for health institutions in the country. So how do we fund it? Every manager, medical director should, think about sustainable financing measures, for dealing with the inflation and rising cost of everything. Let this conversation begin to look at, these hospitals also have businesses within the hospital. They have banks, they have some businesses, they have other means of revenue. What is really happening? How do we ramp up the revenue of the hospital? We know that patients' cost of care is highly subsidized, so does government, apart from paying salary, give monthly subventions? What are they getting from internally generated revenue from these hospitals?
Right.
And what are other innovative ways of ensuring sustainable financing to ensure that no other hospital gets into this kind of situation? These are things that needs to be worked out, and
Right.
everyone should be concerned and get involved in the solution.
Right, Doctor, I appreciate you for coming on. Thank you so much. That's Dr. Laz Ude-Eze. He's the founder Make Our Hospital Work campaign, and he's talking to me about UCH as they seek assistance to offset the debt and ensure uninterrupted healthcare services, and also just healthcare in Nigeria. Doctor, once again, many thanks to you.
Thanks for having me.